Mommies! Thank you for watching our last vlog about the pandemic makeup. I hope you were able to do it on yourselves. But right now, I've decided to do something medical naman. So, my guest is from here, but he finished medicine at the University of Santo Tomas, did his residency training in otorhinolaryngology, head and neck surgery at the Jose Reyes Memorial Hospital in Manila, after which he proceeded with his fellowship training in Madrid, Spain. Right now, he's a fellow of the Philippine Society of Otolaryngology Head and Neck Surgery and is the training officer of the residency training in Corazon Locsin Monteliban Memorial Hospital here in Negros. He is also the section head of the maxillofacial, plastic, and reconstructive surgery in that institution and practices in almost all of the hospitals here. He is a breastfeeding advocate, an oiler. He's one of the most techie doctors that I know. He's a girl dad, a loving husband, and my patients call him Dr. Ear. Ladies and gentlemen, Dr. Michael Joseph David. Hi, Doc Mike. Hello. Good evening.
Hi, Doc Sam. Good evening.
Or Dr. Ear, as my patients fondly call you. Anyway, thank you for this opportunity, giving us your time. Despite your very busy schedule, I know you just came from round. So thank you for this. Para sa mga moms natin to be enlightened with different common topics about the ear, nose, and throat.
Okay, it's my honor.
All right, so wag na tayo magpaligoy-ligoy pa. Let's start with our
Okay.
first topic. So, let's start with the newborns, no? So, as we all know, all newborns are required to have hearing screening, no?
Yes.
After birth. So, how about those newborns who tested with or the result is refer one or both ears?
Okay, so this is called a hearing screening. So it's not sure na the patient, the baby has a problem with his ears. So what we do is if there's a refer, we could repeat the test within 3 hours, or better yet, we can repeat it after a week. So when we get another refer, that's the time that we do further testing, usually with auditory brainstem response testing, which is currently not available in Bacolod. And with the ABR, we would know where the problem is, how severe the problem is, so that we can do whatever it takes to optimize the patient's hearing.
As a pediatrician, my patients who get a refer result are asked to come back after a month. So,
Yes.
late na ba yun? Or because the first concern is bungol or hindi ba makarinig yung anak ko?
O refer na yung anak ko.
Oo, nag-worry na sila.
Yeah, well, it depends on the administration, on the policy of the hospital, but usually that would still be okay. That would be okay. Usually by the time the baby would have gotten better with the hearing in case there's something inside the ear, and most probably that would be around the time that the baby would be brought in during the well baby checkups.
Would you recommend to
Okay.
go straight to ABR or auditory brain response? Would that be practical?
They could do that. They could do that actually, but usually before they decide to go to Iloilo and have it done, they have to see us first, because sometimes you have to clean the ears first, and that would be a concern of the technician of the ABR.
So, what are the steps to ensure or to give a bigger chance of having a pass result prior to a hearing screening or ABR? May
Okay.
kailangan bang gawin
So,
preparation?
yeah.
Sige, let's start with the hearing screening first.
Okay.
For example,
So
they're coming back for the 1 month after.
Okay. So it would be best if the baby is well fed and sleeping. The baby should not be sucking while it's being done. As much as possible, the room should be quiet. Well, it will also depend on the operator. So usually the operator should be very patient with the babies. For the ABR, usually they also do it while the patient is asleep. Usually the instructions will come from the institution where it will be done. So they already know what to do. But usually they would advise that it be done when the baby is at the time that the baby takes a nap, so that it's easier to
Mhm.
do.
Do you recommend sedation? Because I've had experiences wherein the center calls me and asks me
Mm.
to give sedation prior.
It's a call of the center.
So mga mommies, you know what to do. Don't panic yet. The doctors will guide
Yes,
you on what to do. So it doesn't mean that your baby has a refer result that he or she is
so
deaf.
already
So
yes.
can you just briefly describe to the moms how it is done, the release of the tongue tie, and meron ba siyang maximum age, or as early as what age or how many months do you perform it?
Okay, so the earlier the better. As soon as it's detected in newborns, it's better done early. First of all, because since the frenulum, that's the thin layer of mucous membrane that causes the tethering.
Mhm.
It's easier to do it when the baby is really young. We can do it under local anesthesia. I would actually just use topical anesthesia in the clinic.
Mhm.
It's easier to do. If we see these patients at a later age, like 2 years old or 3 years old, the frenulum is already thick. We have to do, instead of just snipping it off, we have to do a Z-plasty. It's a
Mhm.
plastic surgery technique where we do a letter Z incision, then we invert it to make it longer. That usually would entail doing it under general anesthesia. So it will be a bit uh, more costly for the parents.
Lately, kasi
Okay.
I'm very bothered because I see a lot of toddlers, siguro mga 2.5, 3, ganyan, with speech and developmental delays, no? So, unfortunately, I was not able to see them last year because of the lockdown, the pandemic, no? So, when I see them, yun na, they couldn't talk or may delay nga in the speech, no? So, when is the best time to consult a doctor for a possible hearing defect? At one, dapat yun na nga, nagsasalita na
Yeah.
sila, di ba?
Yeah, unfortunately, it takes that long before some of the parents would detect that, because they would get to compare the child with an older sibling na keso mas hindi pa nagsasalita at this age compared kay ate na ganito.
Nauna.
So taon na. Oo.
Mm.
But sometimes I would see patients who the mom would say na we noticed na pag tinatawag hindi nagre-respond ka agad, or kahit na may nahuhulog na whatever na maingay, hindi nagre-respond masyado. And even with the all the videos that they watch and the songs, they could barely mimic the singing. So
Mhm.
that's the time. Usually, they would report it to their pedias, and the pedias would refer to the neurodevelopmental pediatrician and
Mhm.
then to us
Mhm.
for evaluation.
Mhm.
So, but again, the earlier the better.
I suggest for those moms who are scared to go to the clinic, of course, we recommend that monthly checkups for the
Yeah.
infants. No? But we understand the predicament that we are all in. So teleconsults can work, right?
Yeah.
I have had experiences wherein I was able to pick up yung mga cases na gano'n na parang may problem. So immediately we can refer you to the specialists. Is it possible that the hearing screening at birth is um, normal or pass
Normal.
both ears and then later on ma-detect na may hearing problem pala? Does that
Yeah.
happen?
Yes, there are acquired causes of hearing loss. Number one would be dirty ears. So would get a lot of referrals for impacted earwax.
Mhm.
But even with impacted earwax, that would just cause about mild to moderate level of hearing loss. Other causes would be frequent colds, allergic rhinitis that is not controlled. So with that, you would get frequent effusion or fluid in the middle ear that would cause the decreased hearing. If it's not treated, it could lead to chronic otitis media or prolonged middle ear infection, and that's the cause of luga or bulaho in
Mhm.
Ilonggo
Mhm.
that would destroy the eardrum and the other structures of the ear, causing the hearing loss. Rarely there would be babies who, let's say, had critical illness and they had to be given some medications that can be ototoxic. That's very rare, but we also see those cases. But usually for babies, it's more because of the frequent colds and allergic rhinitis
Yes, because
and
they're
the
very,
earwax. Yeah.
yeah, very common at that age. Yun. So you mentioned nga the earwax. That's actually the next thing that I want to ask you. I've noticed
Okay.
also a lot of impacted cerumen lately, no? That's why I make it a point to always check the ears, especially for those patients whom I haven't seen for a long time. So mostly sa kanila impacted talaga, and paano ba? How do we prevent this for the moms, para to avoid na din yung yun na nga, frequent visits, and then ano ba yung mga dapat talagang ginagamit, like is cotton buds, I heard, is not recommended. How about yung mga ear picks or
Yeah.
earwax candles and softeners? So do you recommend those or not?
Okay, so the most common cause of impacted cerumen lately is the use of earphones. I think the use of earphones for
Oh,
online classes. So especially that these kids would use the in-ear type of earphones that
yes,
pushes
like
the
mine.
earwax in. Yes. Another, I think, this is just my opinion, but
Mhm.
because we are staying mostly at home, the overzealous cleaning of the ears of the kids
Mm.
with cotton buds that causes earwax to be pushed in, and it's really hard to remove it. Even for me, I cannot remove my kids' earwax with just the cotton buds. Um, what else? Uh, Usually, those things would cause. Take note: the ears are self-cleaning. You don't really have to use anything to clean the inside. All you have to do is when you give their kids a bath, just wash their outer ear
Mhm.
with a washcloth or even your hands and a little soap, then wipe them dry. So that's wax from the inside that has been pushed out. So
Mhm.
you just have to wait for the wax from the inside to get pushed out after a few days. Then you clean that. So the less you clean the ears, actually, the more clean they are.
I see. What about those mini cotton buds? Because you mentioned earlier
Okay.
yung regular ones, they push the cerumen
Yeah.
in. So what about if you use the smaller ones para you can scoop them out? Pwede ba yun?
Okay. I would suggest that if you're going to use cotton buds, make sure that you see what you are poking at. Do not do a blind scoop inside. But I'm really not a fan of the small ones.
Mhm.
What's good about the big ones is they get to bump into the bony part of the canal, so it kind of protects the ear from accidental perforations. But I've seen a few uh, pediatric and adult patients with ruptured eardrums because of those small cotton tips. So I think there are no. What else? Um, don't believe the ear candling thing. It's more of a comfort. Parang it's for the people who like being touched sa ears, but it doesn't work. For the ones that you see in Shopee or in in Facebook, those ones na battery powered that nga parang umiikot.
Yeah, may
I would not.
light pa. The ones with
Yeah,
the light, yeah.
the lighted picks, they are okay, but you have to have the skills to use them. I would personally not recommend you digging too deep. Maybe if you could see from the outside, that would be fine. But also be careful because these do not pass really good quality checks. So they
Uh-huh.
would have really sharp edges. So be careful. And there are also those battery powered things, I think, that look like drills. Those also don't work.
Okay, so as a general rule, no pointy things on the ear, especially pag maliliit pa, no? Kasi nakakatakot. Which do you prefer pala? Because as you know, I have two kids, no? All the while, I thought my other kid's ear is so dirty because I always see wax coming out of the outer ear. And then the other one naman, sabi ko, always clean kasi I don't get anything, I don't see anything. Tapos, one day, I brought home my otoscope and wala lang, just a spot check, random check. Only to find out that my other
Puno,
kid's ear na parating ah,
malinis.
clean, oo, pag sa cotton buds, guilty, cotton buds, puno ng cerumen. And then the other one who has wax outside, ang linis ng kanal. So parang mas maganda pala yung basa, no, natutuli kaysa sa dry.
Yes, yes.
Hindi naman din maganda kasi pag malinis na malinis,
Super
diba?
clean now.
Yeah, because it can cause infection. And then the cerumen is actually a protective substance, right? To
Yes.
protect our ears from, it catches the dirt. So, yan. So, wag masyadong linis ng linis. Ano ba yung mga frequently asked questions in terms of yun na nga, the ear, nose, and throat? So eto, Doc Mike, very fast lang if you can answer with a yes or no and
Okay.
brief explanation. Okay, so number 1. Is recurrent epistaxis worrisome? Yes or no? And if yes, what can we do to prevent it? Or what are the first aid measures that we can do?
Okay, actually, my answer to that is yes and no.
Oh,
We have to make sure that there are a couple of diagnoses that we have to make sure the patient doesn't have. So, especially for males from puberty to late adolescence, there's such a thing that we call juvenile nasopharyngeal angiofibroma. So those are tumors at the nasopharynx. That's the back of the nose that may cause really massive bleeds. So if you have male kids who have really massive and recurrent nosebleeds, please bring them to us, ENTs. We have to make sure that they do not have that. Well, it's not, the other thing is not so common, hemophilia. I have yet to see a kid with with hemophilia in the Philippines. But aside from that, there would be those who have uncontrolled allergic rhinitis that would cause the epistaxis. More commonly because of manipulation. There would also be kids with structural problems in the nose, like if they have deviated septum. And sometimes there would be a genetic predisposition, like there would be kids whose parents also had this problem. But the good thing about it is they usually outgrow these, outgrow the epistaxis, the nosebleeds. No? But it would be good if these patients have recurrent epistaxis that you refer to us so that we could really look into the nose. About the first aid measures. So what we really teach our patients is to never lie down while you're having a nosebleed. So what you do is you sit or you stand in front of the lavabo or the wash basin. You ask the patient or the child to lower his head like this, then to pinch this area. You have him pinch it for 1 to 5 minutes, check it from time to time if it stops. Usually it stops. If it doesn't, or if you want it to be faster, you can also ask the child to drink cold water or wash his face with cold water. If you must use an ice pack, it's better to put it on the nape and not here.
Yeah. Oh,
And it's also helpful if everybody around the kid stops panicking, because if the panicking will also make the child anxious and will raise his heart rate, which will also make the nosebleed brisker. So keep calm, relax, and if it doesn't stop within 10 to 15 minutes, contact your pedia or contact your ENT, and let's have it checked. One common cause also would be dengue. I think that never left us even with this pandemic. So
that's true.
also check. Yeah, make sure your kids are protected from the mosquitoes.
Follow-up question pala doon sa frequency. How
Yeah.
frequent would it be, what's the incidence para to consider it worrisome? How frequent should it be?
Well, it depends also. So if it's an acute onset nosebleed, like for example, it started today, then the child got two more episodes today, and
Mm-hmm.
it continued on for at least 2 days to 3 days. It would be good if you have it checked by your ENT. No,
Mm-hmm.
but I would also have kids who would have nosebleeds once a week or twice a month. Those are frequent enough, no. But if we check them and we find the culprit and we can do something about it, it's better. So it's better if we have them checked, because sometimes there would be hidden problems that need more urgent attention.
Now we move on to allergic rhinitis. This naman I saw in a Facebook group, no?
Yes.
Yeah. So, meron bang specific diet na kailangan sa to control allergic rhinitis? And what can you say about yung mga air purifiers, humidifiers, dehumidifiers, and the essential oils?
Actually, for specific diets, I haven't heard of recommendation that's really effective. Although I think the parents will not like my recommendation that the kids avoid all the junk. So ultra processed foods, actually the food that can trigger their allergies like eggs. It's not that the eggs or the chicken or whatever will cause the allergic rhinitis, but because it makes them hypersensitive, it also makes their immune system uh, very reactive. So sometimes a little dust will cause a triggering of their allergic rhinitis. So better to also have to control their other allergies. Other things that we could do for our kids with regard to their allergic rhinitis. No, so this one I just appreciated during this pandemic, the air purifiers. So I really recommend them, especially if you live in a very uh, uh, dusty or crowded area. If in the bedroom, the entire family stays, the parents and the kids stay in one bedroom. If you have like if you live near the rural areas, like if you live in a subdivision near the sugarcane fields for here in Negros, it really helps lower down the particulates, especially the pollen and those things. No? What else? I'm not really saying that you have to buy the most expensive one. It doesn't have to have all those gimmicks like the ionizer, the UV. Those don't really help with in terms of allergic rhinitis. What you need is an air purifier that has a good HEPA filter. So you just need the HEPA filter to clean out the particulates in the air. I'm not a fan of those personal necklace purifiers. They're actually ionizers. I've
Mhm.
read somewhere, and even in their marketing literature, that these personal air purifiers or
Mhm.
ionizers work by making particulates heavy and they drop to the ground. So I've
Mhm.
read somewhere that this can actually cause whatever particulates to stick to your clothes, and because it's here, and let's say uh, if we're talking about COVID, about
Yeah.
viruses, it's
Okay.
here, but
Mhm.
if the person who has the virus talks to your face, you still
Mhm.
get it. No,
Yes.
so it's like wearing a bulletproof vest, but your enemy is uh, targeting your head. Since it's an environmental concern, allergic rhinitis, I would recommend that you keep your house really clean.
Mhm.
It's not enough that you do you use your broom to clean your floors. You have to do wet mopping. You
Mhm.
have to do regular wiping, wet wiping of your surfaces. It would be also good. I think it's a practice of Filipinos to change our bed sheets frequently, to at least um, vacuum or launder your drapes and curtains.
Mhm.
It would also be good to avoid putting clothes that you just hang sa hooks and accumulate dust. It would also be good to vacuum your beds, your pillows, so that you could lessen the number of house dust mites in them. What else? It would also be good if you have one cause of allergy would be cockroach problems. So if you
Mhm.
have a lot of cockroaches in the house, make sure that you don't leave dead roaches under the bed at the
Mhm.
back of the cabinets, because when these cockroaches die and disintegrate, that dust is really allergenic.
Mhm. What about
Um,
those fabric conditioners or the sprays that we use to kill the virus and even alcohol? What can you say about
okay.
that?
Actually, those are not allergens. We call them irritants. So
Uh-huh.
really obnoxious scents, or even not the really obnoxious ones. Um, Fumes, mga baho na
Mm.
ginatawag. So
Yes.
those are actually irritants. They could also cause a reaction in the nose and cause us to sneeze, cause us to have watery discharge. So the key is always avoidance. So if you're gonna use alcohol or spray some disinfectant, make sure that the people are not around the area. Um, what else? Animals, pets.
Mhm.
So
Yes.
one thing that I also ask my patients is, what kind of pet do you have,
Mhm.
and specifically what breed, no?
Mhm.
Because there are breeds that are considered less allergenic. So the rule is, the longer the hair, actually the less allergenic they are. So why? Because since these uh, dogs or cats shed less frequently, and they shed long strands of hair, there's less chance for you to inhale them, and for it to cause allergy.
Ah, I see.
Um,
Baliktad pala. Because I
mm,
always thought it's the short-haired ones
Oo.
that
Kaya
are
the short
hypoallergenic.
kaya the short-haired ones, their hair is short because they shed quicker and more frequently.
Mm.
So those
Okay.
smaller hairs can get into our respiratory system. You mentioned about humidifiers, right?
Yes, yes.
Okay. So the thing is, our air conditioning units are very efficient dehumidifiers. They dry up the
Mhm.
air. The problem with that, if it's too dry, it can cause our noses and our throats to get irritated, and it also can trigger sneezing and
Mhm.
nasal congestion. On the
Mhm.
other hand, um, humidifiers, if you use a lot of humidifiers that spew out a lot of humidity into the room air, that may help with
Mhm.
your breathing, but that can also cause mold to grow in your houses. So mold is
Oh,
also a trigger of allergy.
I
What
see.
I suggest is, if you turn on your aircon, you can turn on a humidifier. It will just balance out. But
Mhm.
once you see mold growing in your clothes, in your cabinets, in your bag, on your bags, um, you should reconsider using too much of the humidifier.
Oh, okay.
What else?
Ako kasi
That's it.
I also advise my patients to also brush the aircon filters every 2 weeks. That would help naman siguro, no? Because of course dust accumulates in our air conditioning unit. So
Okay.
we also have to clean them, right?
Remember, those are not actually filters. They are just
Mhm.
screen,
Uh-huh.
ano yun, the plastic screens. So
Yes.
I would personally buy commercial filters that you can
Mm-hmm.
stick to those screens.
Mm-hmm.
3M has
Mm-hmm.
the filtered brand. You can just find them in the um, mall hardware stores.
Mm-hmm.
They actually would help. In lieu of separate air purifier, those actually help a lot. And
Oh,
aside from that, it would be good if you have your air cons cleaned professionally regularly. So
yes.
before, I would just have our air conditioning units cleaned twice a year, but during the pandemic, I noticed we tried to clean them quarterly, and they're really dirty,
Yeah.
especially that we use aircon
Mm-mm.
uh, most of the day.
Yeah,
So have them
kasi
clean, but just have protocols to keep your family safe. I also
mhm.
use oils,
Uh-huh.
but I'm also a scientific mind. So
Yes.
there would be patients who would tell me, Doc, the lavender, lemon, and
Mhm.
peppermint helps. If it
Mhm.
helps, then okay. But
Mhm.
it can also be triggering for some. It would irritate
Mhm.
the nasal mucosa of some. So what I say is, if it works for you, that would be good. But if you see that mas nag-worsen ang allergic rhinitis, mag-trigger siya. So,
Mhm.
I would rather not. Ano, if they really want, they could use their diffusers
Oo.
with just water or just a little oil.
I
They should not
see.
overdo it.
Will sweets, cold drinks cause tonsillitis or make it worse?
Mm,
Kasi parati yung sinasabi, oh, bawal yung
and
matamis,
chocolate.
bawal kumain ng chocolates, bawal uminom ng malamig. Yan. So, anong
Mm.
masasabi ng isang ENT dyan?
Okay. So the sweets per se do not cause sore throats or tonsillitis. Tonsillitis is an infection.
Mhm.
But if the sugar content, the milk content of these foods get stuck into the crypts, those are the small holes on the surface of the tonsils. And it's like if you don't brush your teeth, you get tooth decay. So
Yeah.
those food particles that can get eaten up by the bacteria, that can possibly cause progression into tonsillitis. I
Mhm.
would just tell my patient, the parents of my patients or my patients themselves to,
Mhm.
whenever you eat or drink anything other than water, you drink water after, just to
Mhm.
wash them down. But of course, it would be better if they could they could brush their teeth after.
Yeah. Because cold drinks can actually soothe the pain of having swollen tonsils, right? So
Yeah,
I don't like totally agree with the
nabawal.
cold drinks. Oh, sabi ko lang, wag lang iced siguro kasi baka mapaos.
Oo.
Oh, but actually, I'm not so strict about the cold drinks. Siguro yung sweets kasi it's sometimes sapnot siya or it irritates and
Mm,
then minsan nauubo-ubo, ganon. So,
yeah.
yeah, oo. Pero, of course, yun nga, you're right. You should first know what's the etiology of the tonsillitis. Is it
Mm,
viral? Is it bacterial? And then, it's not really the sweets that caused it, no? Meron talagang infection na involved.
mm.
So, yes, there you go. We're done. That was fast, ha? That I think this is my fastest
Oh,
episode.
really?
Yes. Thank you for your time. And then I hope this won't be the last. And
Okay.
looking forward to more referrals to you.
Okay.
So
I'll be
hope
glad to take them.
Yeah, and hope to see you in person. Medyo matagal na rin tayong hindi nagkikita in
Yes.
person. Yes.
Yes, yes.
Regards to Nona and the kids, and take
Okay.
care always. Thank
Okay. Thank
you.
you, Doc
Thank you,
Sam.
Mike. Bye.
Bye-bye.
So there, mommies, that was our episode. Thank you again, Doc Mike, for a very precise, clear, and comprehensive explanation of our topics. So mommies, pag may nakalimutan kayo or if you have questions, you can replay this vlog. And of course, don't forget to like, subscribe, and share. Pero syempre, dapat magpatingin din tayo sa mga sarili nating mga doktor para sigurado. So my takeaway naman for this episode is that listening is often the only thing that is needed to help someone. So I hope that we'll lend a listening ear to those people who are in need. Thank you and God bless. Bye, mommies.